A very good afternoon to one and all. This is Mrs. Mary Ratnanita once again, welcoming you back to your pharmaceutical microbiology class. The topic for today's our class is assessment of new antibiotics and testing of antimicrobial activity of a new substance. So, assessment means checking. You need to have a confirmation that whatever the antibiotic, whatever the purpose for which we are using the antibiotic is success. I mean, like it is up to the mark or not. We are checking the quality level of this antibiotic and whether it is able to kill the microorganisms or whether it is able to reduce the disease conditions is nothing but your assessment. And whenever any antibiotic is newly produced and it has to be released in the market, it has to be assessed for certain properties, and it has to be done by certain bodies like your health technology assessment bodies and all. So this generally new antibiotics are and after clinical trials they are assessed by the HTS and then they are released into the market. So let us see what are the learning objectives. So by the end of this topic, the student shall be able to explain the need for assessing an antibiotic and what is the procedure by which the health technology assessment bodies assess the antibiotics and what does not fall under HTS or what is that the HTS does not cover is also learnt by this by the end of this topic. So coming to your introduction part, so when you talk about the antibiotics, generally why are we using antibiotics? Nowadays it has become a common criteria to use an antibiotic. If you have temperature or if you have fever, if you go to the hospital, the first thing they write is antibiotic. If you have cold and cough, the first thing they write is, they prescribe is antibiotic. If you have severe problems like you have cancers, AIDS and all, still they write prescribe antibiotics. So what are these antibiotics? So these antibiotics are nothing but these are the chemical substances produced by microorganisms in order to kill other microorganisms. So those are nothing but your antibiotics. And these antibiotics are capable of reducing or killing the microorganism that causes the infection, thereby reducing the infection and reducing the disease. So when you're using the drug and whatever the organism which is for which against which you're using the drug, if the organism is withstanding the effect of the drug, if it is not showing the response what the drug has to show, I mean when the drug is applied to the antibiotic, when the organism, when whatever the action the organism has to show, if it is not showing, that means the organism has developed resistance against that particular drug. For example, now if in a common way, if I say your teacher scolds you, I mean like how to tell you, no, you're using an tablet for everything nowadays. Some people have the tendency of consuming tablets for each and every silly thing, like even if they have stomach pain, they take a tablet. Even if they feel that they're going to get a pain in their abdomen or the stomach ache, they'll take tablets. So this consumption, what will they do? Since they're continuously taking the tablets, your body gets used to that particular medication. And when you take the tablet to have a particular effect on your body, that effect is not shown by your body because your body get used to it. That's why body is not able to respond to that particular drug properly. So that is nothing but tolerance or resistance. So when antibiotic is taken to treat an organism, to treat an infection, when the organism that is causing the infection is not reacting according to our thought process of what the organism has to react when the antibiotic is used, that means the organism has developed your antimicrobial resistance. And generally this antimicrobial resistance occurs when the organisms undergo mutations, like when they change their pattern of style or anything, and making the medication which is used to treat the infection ineffective. So the major issue here is adequate evaluation of that particular antibiotic, of any particular antibiotic which is being newly produced, has to be done. And generally this is done by your health technology assessment bodies, but what you call is HTA bodies. And the main thing what they have to consider when you're evaluating an antibiotic is your antimicrobial resistance, in order to provide an benefit, healthy, full-fledged benefits to your patients or to the society or to the people. or to the public. Because if your antimicrobial resistance is developed, and if the patient is not responding to that particular treatment, then definitely immediately another antibiotic has to be given to the patient in order to protect the patient from getting more sick, or to preventing the patient from dying from the previous infection what they had. So that is the major motto of your HTA bodies. That is, they have to evaluate the antibiotic taking your antimicrobial resistance into consideration. Here, majorly, there are 10 important elements of value that has to be classified. But according to but out of these 10, only 4 were placed under, discussed, legally under your, traditionally under your HTS, and remaining 6 aspects were not traditionally placed under your HTS. So here the major problem here is, the 2 major challenges what you face here is, when you want to perform a release a drug into the market, first we need to go for clinical trials. We know even now in corona situation, people, scientists are trying their best to go for clinical trials and find out the vaccine or medication for this corona, but they're failing in 3rd and 4th stages. So here in the clinical trials are designed for establishing non-inferiority, whereas the HTA always ask for superior clinical responses, which is not practically possible with all the medication and all the time. And at the same time, HTA bodies do not have mechanism to evaluate the health benefits of antibiotics, because the aspects what they that fall under these HTAs does not have any impact on the health benefits, rather than health benefits to control the antimicrobial resistance. So the aspects that are covered under HTA are not directly related to health. They are related to their financial status and needs, but they don't directly relate to the control benefits, or to control AMR. Those health benefits were not included in the HTA. So the benefits that generally falls under, as I said, there are 10 elements that has to be discussed. The 4 elements that were traditionally placed under HTA were health gain, unmet need, cost offsets, productivity benefits, whereas the remaining 6 are insurance value, diversity value, diagnostic value, uniqueness or innovation value, enablement value, and spectrum value. So these are the 10 elements which we need to learn take into consideration while you're releasing a new antibiotic into the market. So talking about the benefits that falls under HTA. So first is health gain. So any drug, the most important thing is, whatever the drug you're using, it should increase your lifespan or life, and at the same time the lifespan should be good enough. The quality of the life should be good, and this is accepted by HTA also. And here the HTA, for this they ask for evidence, which is not often possible with antibiotics, because high level superiority trials cannot be given as evidence to HTA. And unmet need. Second is unmet need, where the severity of the disease and the current availability of alternative treatments. So, for example, take corona into consideration. You have a disease very severe, but you don't have the alternate treatment for that. So these are the needs which are not meeting each other, and it involves use of priority of pathogen lists. So that is the second element that you need to that falls under your HTA. Cost offsets. So it includes reduction in the cost in other areas as the result of use of new medicine. So when your the cost of the drug has to be reduced, and it involves using modeling studies and evidences from clinical trials. So it is considering here the cost of the antibiotic which is newly produced. When it is released into the market, the cost should be very less, so that the people can easily acquire them and use them. And productivity benefits, it involves profits or losses related to the value of, so when you're taking a medicine, for example, if you're watching a movie, you go to a movie, you see that, you like it, you try to enjoy that movie. And when you go to, if at all, if the movie is not good, what do you say? Waste of time. Why did we come here unnecessarily? There is nothing in the movie, waste of time, boring. I felt like sleeping. I almost fell asleep. So what are you saying? Whatever the time you spent, you felt that it is a loss. So that is what is the major thing you have to take it into consideration. It involves profits or losses related to value of patient's time, because time is also most important. Now you say now you got diagnosed by a disease and the doctor says you need to use these antibiotics for a particular period and you will be cured. So if you use the drug for that particular period but still the effect is not seen, then what you say, waste of time, unnecessarily I wasted using these tablets, I should have gone to the other doctor or I should have used other medicine so that at least I could have been better than what I am right now. So in this way, these profits and losses regarding time, receiving medical care, everything has to be taken into consideration here. And it involves using modeling studies or even evidences from the clinical trials and observation studies. So that is about your as 4 aspects that falls under your HTA. Now talking about the other aspects that were not traditionally placed under HTR, insurance value. That means whenever when you're using a treatment and suddenly an unwanted or unrequired effect occurs, so that might need more value of drug, that might needs different drugs and the cost of treatment might increase, and all these will be covered in your insurance value. And it is analogous to availability of fire engines. So even fire engines and precautionary principles all will be included in your insurance value. Now diversity value, it is the selection pressure, that is antibiotic, whatever the antibiotic you're uh, making or releasing into the market, whether this antibiotic is able to selectively kill that drug or not. And for example, if the patient is having multiple disorders and the antibiotic is working only on one microorganism, so what is happening, that will work on this microorganism but the rest of the microorganisms will grow and develop, making this antibiotic also ineffective. So that is nothing but your selection pressure, whether you have this organism, this antibiotic will work on that particular organism or not, is also the most important thing which you need to consider. And it involves evidences that reducing selection pressure by withdrawing antibiotic for, so what you have to say is, if at all, if this antibiotic is not used for a particular period of time when the patient is suffering from a disease, then the susceptibility or the susceptibility to the infection will increase. You need to prove that. Until unless, if you take this medication, this problem will go down. If at all, if you stop using this medication, if you don't take this medication, the problem increases. So you need to prove that the particular antibiotic, if it is withdrawn or if it is not used, the problem would raise. And for this also you can go for modeling studies. And diagnostic values. So diagnostic values, if infection is diagnosed at early stage, then appropriate antibiotic treatment or therapy can be started at early stage. So here you need to have evidence for accuracy, like evident report stating that you are particularly suffering from this disease or you are suffering from this infection. So that's why when you go to a doctor, the doctor does not immediately write prescribed medications for you listening to your symptoms. So what he do, he'll give you general medication. For example, if you say that I have fever, I lost 10 kgs of weight and I'm not able to eat anything, I don't have appetite and all. So what the doctor does is, he'll give you general medication to reduce your fever and to increase your appetite. But basically, he'll get some idea listening to your symptoms. Then what he does, he prescribes certain investigations, certain tests. And once you go for the test and you bring back the report to the doctor, he checks the report, he gets an assurance that particular person is suffering from particular disease or infection, then only he can prescribe the drug or medication. So it needs accuracy of the evidence for the test accuracy. Then uniqueness or innovation value. So it is the potential value associated with a new or unique mechanism of action. So when you are saying that this drug is being released into market, you need to know what is the mechanism of action, how this drug is acting. Some drug says it bypasses first pass metabolism because you, for example, if you're using sublingual tablets, so the advantage what you say is the drug need not go through the normal procedure because it can since it gets affected by the acids in the HCl, so it bypasses the first pass metabolism. So whatever the mechanism of action, the potential value associated with the new mechanism of action has to be given. And antibiotics with novel mechanism, they provide they prevent the cross resistance occurring, like when a combination of diseases are prevailing in a person. So the novel mechanism, the good antibiotic, will prevent this cross contamination and treat the disease. And discovery of new mechanism of action of an antibiotic makes it easier to follow on product to enter market. So if it has a proper defined mechanism of action, then you can easily explain it to everyone. It can be released into the market easily. And for this also, they need to provide the evidence and enablement value. So it is the availability of effective antibiotics supporting surgical procedures. So what you say here is, whatever the antibiotic you're using, it should support the treatment to a patient whose immunity levels are also very less. So for example, if you talk about an AIDS patient, or if a patient who has undergone organ replacement, so surgery. So definitely when you're going for organ replacement surgery, their immune system would be suppressed. Why? Because the body has to accept the organs from outer side. So that is a foreign body. If your immune system is perfect and it is acting normally, definitely it will not accept the foreign organ to enter into your body. So immediately your body would react. So in order to avoid that reaction, what you do is the doctors suppress the immune system by providing immunosuppressants, and then you replace the organs. So in such case, if at all the antibiotics are showing different effect or side effect, because the body's immune system is very less and you are using high level antibiotics, if it is causing side effect to the patient, then it is also a problematic issue. So even that enablement, the availability of effective antibiotics also is very important. And next is spectrum value. So to what extent, what spectrum these values occur? In terms of when you antibiotics, they say that narrow spectrum antibiotics are better than broad spectrum, because the antimicrobial resistance will be very less. Development of antimicrobial resistance in damaging a drug would be very less. So why you need to go for this additional establishment means, the antimicrobial resistance is a public problem, and if at all the government does not take care of reducing this problem, definitely it will be a hazardous issue to the society. So the current method of HTA evaluation does not include this aspect into the consideration. So they are not worried about, see, whatever the aspects where whatever we have discussed, it did not cover where the antimicrobial resistance is being controlled. So here the HTA evaluation does not count this value of reducing the public health threat. Instead of that, it covers the insurance value, financial value, and time consuming value, everything, but it not consider the threat. And second one is diverse set of inferior antibiotics is available to society. So since antimicrobial resistance is increasing widely, it became a valuable developing a new antibiotic for your multi-drug resistance pathogen. So what is happening here, when you're using drugs in combination, antibiotics are used in combination, if at all one drug is being it has developed resistance to that if one bacteria develops resistance to one particular drug, at least the other drug would treat the act on the microorganism. So combination therapies are much more required, because diverse set, most broad spectrum treatment is required. And non-clinical microbiological data are important for demonstrating the value of antibiotics. So non-clinical and microbiological data for antibiotics can predict results. For example, now when you're talking about microbiological data, so in microbiology, if you take corona into consideration, now in corona, what we are saying, the corona's lifespan is like that. It is existing in air for this time, so much of time. It is existing on the clothes for fabric on this much of time. When it enters, it is first causing a respiratory problem, and then if you prevent this, you can. So this is the data which is given by microbiologists by studying that particular microorganism, and this data can predict the results. That means, see, we are not having medication for corona, but we have ways to control corona. That is, you need to avoid your social meetings, you need to avoid your personal contacts, and you need to avoid gatherings, and you need to wear masks. All these, from where did you get this information? from your microbiological data, stating that this is airborne disease. If you talk also, it can spread. So if you, in order to avoid the spread, what are you doing? You're wearing masks and masks. So you're not supposed to, it can spread even by touching. So what information you got, you're not supposed to touch. And it can be removed by washing your hands frequently. So by this we came to know that we have to wash our hands as frequently as possible in order to uh, remove the get rid of that organism, even if it is on your hands or even if they are on your clothes. So in this way, this microbiological data helps in predicting the results. Due to the difficulties in conducting trials, clinical trials for antibiotics for multi-drug resistant pathogens, regulator generally these data will be accepted. See, now for this, your corona is a multi-drug resistant pathogen only. It is not able to, we are not able to control that organism using many drugs. So what is happening here? Since we are not able to get the treatment, we are accepting the microbiologist data to go for the to um, um, at least to control the unmet needs. So that is what is your non-clinical and microbiological data gives. Antibiotics have benefits that go beyond the patient treated. So when one patient is treated with an antibiotic, the spread of infectious disease is reduced, by thus benefiting the population. So now I have corona. I am not being treated. I am left into the society. What is happening? Definitely, I would spread the disease. If at all, if I have corona, I've been treated, and what am I doing? I'm not spreading. So in this way, you're preventing the population. So this spread of disease can be, the disease in me can be treated by using your antibiotics. And antibiotics enable other types of treatment and procedures. Not only treating the infectious diseases, but these antibiotics are also used in surgery and chemotherapies also. So in order to kill the organisms, and in chemotherapy in cancer patients also, and also in order to avoid the infections after surgery, post-operational infections can be prevented by using your antibiotics. So these are the aspects which are required in order to assess your antibiotic. So this topic is available in NKJN, and even also in net you have lot of information, so you can go through. And with this we have completed this topic. If you have any doubts, you can contact me, and let's meet with a new topic in the next class. Thank you.